In this video, I will teach you everything you need to know about the benefits, contraindications, and uses of berberine. And I predict that by the end of the video, you will be surprised by at least one of its effects. Health benefits of berberine and how to use it. Hi, I'm Dr. Manu, and this channel is all about health and wellness. I help you by providing certified scientific information in a simple and cohesive way. Now, let's dive right in. What is berberine and where is it found? Berberine is an alkaloid bioactive compound that can be extracted from several different plants, including a group of shrubs called berberis, including the barberry plant, which contains it in considerable quantities. Berberine has a long history of use in Ayurveda and traditional Chinese medicine, where it was used to treat various ailments. Now, modern science has confirmed that it's beneficial for a wide range of health problems. In fact, it has been seen that this compound is one of the most effective natural supplements available, having effects comparable to those of some pharmaceutical drugs in terms of effectiveness. Once purified, berberine extract is transformed into a powder, usually to make tablets. The end result is called berberine hydrochloride. What are the benefits of berberine? It causes a major reduction in blood sugar levels. Many studies show that berberine can significantly reduce blood sugar levels in individuals with type 2 diabetes. In fact, its effectiveness is comparable to the popular diabetes drug, metformin, glucophage. It acts through various mechanisms. Decreases insulin resistance, making the blood sugar-lowering hormone, insulin, more effective. Increases glycolysis, helping the body break down sugars inside cells. Decrease sugar production in the liver. Slows the breakdown of carbohydrates in the gut, and increases the number of beneficial bacteria in the gut. In one study of 116 diabetic patients, 1 gram of berberine per day lowered fasting blood sugar by 20%, or from diabetic to normal levels. It also lowered hemoglobin, A1C, by 12%, a marker for long-term blood sugar levels, and also improved blood lipids like cholesterol and triglycerides. According to a big review of 14 studies, berberine is as effective as oral diabetes drugs, including metformin, glipizide, and rosiglitazone. It works very well with lifestyle modifications and also has additive effects when administered with other blood sugar-lowering drugs. Berberine may help you lose weight. In a 12-week study in obese individuals, 500 milligrams taken 3 times per day caused about 5 pounds of weight loss on average. The participants also lost 3.6% of their body fat. Another study that was conducted on 37 people with metabolic syndrome had them take 300 milligrams 3 times per day. The participants saw a significant reduction in their BMI level from 31.5 to 27.4, or from obese to overweight in only 3 months. Other health markers were also improved and belly fat was lost. The researchers believe that the weight loss is caused by improved function of fat-regulating hormones, such as insulin, adiponectin, and leptin. Berberine also appears to inhibit the growth of fat cells at the molecular level. Berberine lowers cholesterol and may reduce your risk of heart disease. According to a review of 11 studies it can lower total cholesterol by 0.61 millimoles per liter, lower LDL or bad cholesterol by 0.65 millimoles per liter, lower blood triglycerides by 0.50 millimoles per liter, raise HDL or good cholesterol by 0.05 millimoles per liter. It has also been shown to lower apolipoprotein P by 13 to 15%, which is a very important risk factor in developing cardiovascular disease. Also, according to some studies, berberine inhibits PCSK9 enzyme, leading to more LDL being removed from the bloodstream. Diabetes, high blood sugar levels, and obesity are all risk factors for heart disease. This supplement appears to help with all of those at the same time. Berberine has antioxidant and anti-inflammatory properties. In some studies, it has been shown to have potent antioxidant and anti-inflammatory effects. The antioxidant and anti-inflammatory activities of berberine were noted with changes in oxidative stress markers, antioxidant enzymes, and pro-inflammatory cytokines. Berberine inhibits oxidative stress and inflammation in a variety of tissues, including liver, adipose tissue, kidney, and pancreas. Berberine can help fight infections. It has been shown to fight harmful microorganisms, including bacteria, viruses, fungi, and parasites. It also boosts the effectiveness of antibiotics. From this study, I quote, Berberine is an isoquinoline alkaloid widely used in the treatment of microbial infections. Recent studies have shown that berberine can enhance the inhibitory efficacy of antibiotics against clinical multidrug-resistant bacteria. Berberine can reduce fat buildup in the liver, which should help protect against non-alcoholic fatty liver disease. This therapeutic effect is mediated by improving glycolipid metabolism. Berberine can help you manage heart failure. One study showed that it drastically improved symptoms and reduced risk of death in heart failure patients. Berberine can help you fight acne. In a clinical trial of 50 people with moderate to severe acne, consuming a teaspoon of dried barberries, the berries containing berberine, 3 times a day for a month, led to a 43% drop in the number of zits and about a 45% drop in inflamed zits, and all this without side effects. Berberine may help treat symptoms associated with polycystic ovary syndrome. These symptoms include high blood sugar levels, weight gain, and high cholesterol. Several studies have found that berberine increased insulin sensitivity and improved fat metabolism in people with polycystic ovary syndrome. Additionally, berberine directly inhibits inflammatory processes including TNF-alpha, interleukin-6, and cyclooxygenase 2. Inflammation plays a key role in polycystic ovary syndrome, and most women who suffer from it have some type of chronic inflammation. A 2011 study compared berberine and metformin, a pharmacological drug, in a test of women with polycystic ovary syndrome. Researchers found that berberine was better than metformin for its ability to reduce waist size, waist-to-hip ratio, blood triglycerides, total cholesterol, LDL cholesterol, the bad one, and increase HDL cholesterol, the good one. Other additional benefits of berberine. Preliminary research suggests that berberine may be useful in combating degenerative neurological diseases, such as senile dementia and Alzheimer's. A 2015 study found that berberine can improve neuroprotective pathways and counter the degeneration of neurons. Furthermore, a 2011 study concluded that berberine helps prevent oxidation damage to brain biomolecules, inhibits enzymes that break down important memory-enhancing molecules, reduces peptides that interfere with proper memory function, and lowers lipids that interfere with the blood flow of the brain. Another result of berberine includes a slowing action on fecal movement in the intestine, thus acting as an antidiarrheal. This effect has also been seen in people with irritable bowel syndrome. Finally, berberine may have anti-cancer effects. Since it acts as an antioxidant, it may help fight underlying oxidative damage associated with cancer development, has also been proven effective in causing cancer cell death, prevent cancer cell replication, and inhibit enzymes involved in the life cycle of cancer cells. For now, however, these latest results are based only on test tube studies. Berberine dosage and side effects. In the vast majority of cases studied, berberine was taken in capsules of 500 milligrams, 3 times per day before meals, a total of 1,500 milligrams per day. Berberine has a short half-life and should be taken 3 times a day to keep the component stable in the bloodstream. Generally, berberine appears to be safe and well tolerated. It is not hepatotoxic, but rather has an anti-cetotic and anti-inflammatory function. In some situations, berberine may cause digestive side effects such as constipation, flatulence, and stomach pain. Furthermore, as there is little control by health authorities over supplements, it is preferable that berberine should be avoided by women who are pregnant and breastfeeding. Berberine absorption and bioavailability. All that glitters is not gold. Berberine has a major limitation. It has poor oral bioavailability. The safest and most studied component that optimizes the action of berberine by greatly increasing its bioavailability is silymarin, which derives mainly from the milk thistle extract. A good efficacy of this combination has also been confirmed in patients intolerant to high dosages of statins. In some cases of patients completely intolerant to statins, the administration of berberine and silymarin has even been able to completely replace the statins. Drug interactions. If you're taking any medication, it's important to speak with your healthcare provider before taking berberine due to the risk of interactions. In particular, berberine may interact with medications that lower blood sugar, increasing the risk of having too low blood sugar levels. It may also interact with medications that are processed by the liver, especially immunosuppressants and antihypertensives. If you are unsure whether you should take a berberine supplement, speak with your doctor for advice. In a nutshell, Berberine is an active ingredient that can be very useful in counteracting the progression of certain inflammatory and infectious disorders, especially if related to the metabolic processing of sugars and fats. Whether it is in preventing or in fighting an ongoing disease, it is an active substance that can certainly make a difference. If you like this video, don't forget to like, subscribe, and hit the notification bell to stay up to date on new content. Thanks for watching.